Welcome back to Bloom. You know, living in Florida can often bring unwanted dark spots on our skin. And as we grow older, age spots, blood vessels, and discoloration can also appear to muddy our complexion. Our next guest is Dr. Hermann, and she is here to tell us about a non-invasive treatment with IPL laser. That's going to help with advanced skin pigmentation correction. And I'm excited to hear about this.
Thank you.
Welcome back, Dr. Hermann.
So good to be back.
I know you have a staff at your wellness clinic that have been helping people for over a decade restoring their youthful skin texture. Why are you so passionate about helping people? And tell us a little bit about your practice.
Oh, yeah. I mean, I help people ideally try to feel better, nutrition, weight loss, hormones, and then look better. You know, it's all about just being the best who we can be through a non-invasive. I mean, there's so many things we can do that really don't cause downtime, that are not any risk, you know, very minimal risk. Yeah.
And living in Florida, are there certain, you know, sort of skin things we're more prone to here?
Oh, yeah. I mean, especially myself, you know, fair people, we're very prone to sun damage.
Yeah.
So really, the IPL, which we're talking about today, helps lift pigment, sort of sun damage, sunspots, modeling, little blood vessels that we sometimes get, which are also, you know, around our nose or wherever on the face that are a part of sun damage. So when I think of anti-aging, I think of three things. Skin texture, which is going to be fine lines, crepiness, and that we can address with the Morpheus, with Botox, peels, skincare. Loss of volume. As we get older, we do sometimes lose some volume in our cheeks and lips, and that's filler. But then the other pinnacle of looking young is the skin tone. You know, do we have sort of an even skin tone? And that's where the IPL comes in.
So tell us a little bit about the IPL procedure, if you will.
Yes. So the IPL is a laser. It basically stands for intense pulse light. And basically it's very specific wavelengths of light that target brown spots and red spots. So brown spots very much on the surface of the skin, and red spots, which would be some of these little veins that sometimes we call telangiectasias that can show through the skin. Without damaging the rest of your skin. So after someone has an IPL treatment, their skin texture is the same. The brown spots actually will get darker and look a little bit like coffee grounds, and then over the course of a week or so exfoliate off.
And so this is what we're seeing right now. Talk me through what this is.
So this is the IPL machine that we use in our office. And here we have Michelle doing a treatment on a patient. We do wear eyewear for this whenever we're using intense pulse light or a laser. Then she's applying, this is actually ultrasound gel, which just helps for conduction of the light to the skin.
Yeah, that makes sense.
Yeah, and it really then feels very similar to hair removal or another type of treatment that would just be sort of a snapping of a rubber band.
It's a very good description of it. You're very good at talking us through this.
But then basically people, you know, we wipe off the cream and wash the face, can put makeup on right away, go back to work. Usually we do recommend a series of 3. Typically what will happen is a layer of the discoloration will come up, and then there may, but it's taking it in layers, so then we may need to do it again to get another layer. People can decide if they want a second or third treatment. I mean, one treatment sometimes is enough, but often we do it as a series of 3.
So what's our downtime we're talking about for a procedure like this?
I mean, none.
Really?
I mean,
they say they go back to work.
And it lasts for years, so really it does make your skin smoother. But over time, as we get more sun exposure, people might want another round, another series of 3 in, you know, 5 years or so. My experience is I had it for my wedding when I was 30, then when I was 35, then when I was 40, then 45. And at this point, I don't need a series of 3, but just, you know, after summer,
kind of a thing.
You get some spots. Right, so maintenance.
So this sounds like something really good for, as you're saying, sort of 30 and up for people here in Florida because of the sun and everything we deal with.
You know, if you start seeing little sunspots and things like that, they're so easy to fix.
Well, I'm glad you brought that up. Thank you, as always, for bringing us